Good afternoon, everyone. You are very welcome to the SunSmart for Parents webinar, Protect Children's Skin from Sunburn and Sun Damage. The panel will be delighted to receive any questions that you may have. Please use the Q&A feature located at the bottom of your PC or laptop screen. If you're using any other device, you may find this feature located at the top of your screen. Now, without further ado, I will hand you over to your host, Dr. Breda Neville, Specialist in Public Health Medicine, HSE NCCP. Thank you.
Good afternoon, everyone, and welcome to today's webinar, SunSmart for Parents, Protect Children's Skin from Sunburn and Sun Damage, which has been organised by the HSE's National Cancer Control Programme. So we have an interesting lineup and some great speakers. Maria McHenry is a Cancer Prevention Officer at the HSE's National Cancer Control Programme and coordinates the implementation of the National Skin Cancer Prevention Plan. And today she'll be discussing key findings from new research commissioned by the HSE's National Cancer Control Programme on parents and guardians' attitudes, behaviours, knowledge and awareness of sun protection in Ireland. Louise Fleming is a clinical nurse specialist working in St Vincent's University Hospital with the focus on skin cancer since 2019. She's been working in dermatology since 2015, and in 2023 she completed a Master of Science in Skin Lesion Management at the University of Hertfordshire. Louise has also recently completed the Nurse Prescribing Certificate with the Royal College of Surgeons in Ireland. Aoife Maloney is a registered general nurse since 2011 and a clinical nurse specialist working in St Vincent's University Hospital with the focus on skin cancer since 2020. She's been working in dermatology since 2018, and in 2023, she completed a postgraduate diploma in dermatology at UCD. Aoife is also currently nearing completion of the Nurse Prescribing Certificate with the Royal College of Surgeons in Ireland. Louise and Aoife are both involved in a wide range of research in relation to skin cancer and sit on development groups for new guidelines for patients with skin cancer at the National Cancer Control Programme. And today, Louise and Aoife will discuss the importance of sun protection for children and highlight steps that you can take to look after your children's skin. So we know that playing and spending out time outdoors is good for your child, but it's important to protect their skin and your own when outside in the sun. We hope that today's webinar will increase your awareness that being sun smart will protect your and your children's skin and reduce your risk of skin cancer. The webinar today is being recorded and a link will be sent out afterwards so that you can watch it back. We cannot answer individual medical questions or give individual medical advice. You can add any questions that you may have to the chat function. The questions will be answered where possible at the end of the webinar during the panel discussion, and otherwise someone from the team will respond to you directly with a response. So now I'm going to hand you over to Maria to tell us about the key findings from the research commissioned by the National Cancer Control Programme on parents and guardians' attitudes, behaviours, knowledge and awareness of sun protection in Ireland.
Thanks, Breda. So I'm going to discuss the survey that we conducted last year on parents and guardians' attitudes, behaviours, knowledge and awareness of sun protection in Ireland. So this report has just been published this week, so it's available on our website on hse.ie/skin cancer prevention. So just before I go through the key findings from the research, I just wanted to give you kind of some background information. So the National Skin Cancer Prevention Plan, which started in 2023 and runs till the end of 2026, is aimed at tackling the most common cancer in Ireland. And the plan focuses on the fact that most skin cancers could be prevented by protecting skin from the sun and not using sunbeds. So there is a number of high-risk groups that we're specifically targeting as part of that plan. And this includes children, so 0 to 12 years as part of the plan. One of the action areas within the plan is to involve parents, guardians and parent groups in the development and promotion of skin protection resources for babies and children. So I suppose that's where this piece of research came from. So we wanted to, I suppose, get some insights into what parents' attitudes, awareness, knowledge and behaviours when it comes to sun protection here in Ireland, because there isn't any research currently that shows that for this cohort. So we know that playing and spending time outdoors is good for children, but it is also important to protect their skin when they're outside in the sun. So children have lower concentrations of the protective skin pigment melanin and thinner skin, so they are more susceptible to UV damage. So I suppose UV comes from sun and artificial sources such as sunbeds, and we know that this damage is cumulative. So the more damage you get over your lifetime, it adds up each time you have unprotected sun exposure. And I suppose you don't have to burn. Your skin doesn't have to burn in order to get that damage. So it's really, really important to protect your skin both here in Ireland and when you're abroad. We also know that UV exposure during the first 10 to 15 years of life makes a disproportionately larger contribution to lifetime risk of skin cancer. So that's why I suppose within the skin cancer prevention plan, there is a big focus for, I suppose, developing sun protection behaviours for children from a very young age. It's really, really important for them, I suppose, to learn that. And I suppose as they then grow in through teenage years, through to adulthood, they're more likely to carry on those behaviours if they learn them from a young age. So to support the objectives of the National Skin Cancer Prevention Plan, the HSE's National Cancer Control Programme commissioned Amoric Research to conduct a national survey exploring the attitudes, behaviours, knowledge and awareness of sun protection among parents in primary school children in Ireland. So I suppose the objectives of the piece of research was to understand the experience of sunburn for both parents and their children, to understand sun protection behaviours and sunbed use among parents, their attitudes towards tanning and their desirability to tan, knowledge of skin cancer risks and protection methods, and then also to look at effective communication of health messages about sun protection for both parents and their children. So I suppose some of the key things to understand before we run through the findings is the methodology. So it was an online survey which we developed with Amoric Research. The sample, so it's a nationally representative sample of 591 parents of primary school age children in Ireland. The fieldwork, so the survey was conducted between the 12th of November to the 3rd of December 2024. And then when we look at the profile of parents and guardians that were surveyed, so you can see there's a close, nearly 50-50 split between males and females. Then you can see the age groups, so 18 to 24 years were 24%. Then we had 48% of the 35 to 44, and then 28% of the 45 and older. Then we look at their children. So you can see there's a split between the 4 to 6 years, 7 to 9, and 10 to 12. It was also conducted in all parts of the country as well. So you can see there the breakdown of Connacht, Ulster, Dublin, the rest of Leinster and Munster. So I suppose we're going to run through now the key findings from the research. So the first section is the parent sun protection behaviours. So at the beginning of the survey, respondents were introduced the Fitzpatrick skin type classification scale, which is what you can see on the right of the screen. This is a classification system characterizes human skin based on the amount of melanin present. So I suppose it helps to predict the risk of sunburn. So the skin type classification scale ranges from 1 to 6. So 1 being high risk, 6 low risk, and it considers skin color, so whether someone is pale white or to black. And it also looks at how the skin reacts to UV. So those who are most sensitive and those who would maybe not burn at all or would tan, or their skin would pigment more. So we know that people with pale skin that burns easily and never tans, who would have blue eyes, blonde or red colored hair and freckles, are characterized as having skin type 1, who would be the highest risk from UV radiation. And those with black skin, which tends to, I suppose when they're exposed to sun, they rarely, if ever, burn and have dark brown eyes and black hair. So these would be characterized as skin type 6. You can see there the scale on the right-hand side. So we do know that even though skin cancer is relatively rare for people characterized as having skin type 5 or 6, those that do occur are often detected at a later, more advanced and dangerous stage, as the skin cancers can often present atypically. So we know that skin cancers, especially melanoma, often presents on non-sun exposed sites in people of colour, such as on the soles of the feet or the palms of the hands. We know that most people living in Ireland have fair skin type, so that would be skin type 1 and 2. So this burns easily and tans poorly early, so are particularly vulnerable to UV damage and skin cancer. And I suppose it's important to note that the person's skin type is genetically determined and does not change or vary based on level of tanning. So I suppose when we asked this question, so we asked to describe their natural sun-exposed skin color. You can see there that nearly 2/3, 64% identified as having white skin, 16 selected pale white skin, 14 chose light brown, and a small minority of 6% reported having darker skin tone. So I suppose then what we look at is they were asked to describe how their skin reacts to sun exposure without protection. So it's not surprising that given their skin color, the majority reported strong or moderate sun sensitivity. So 13% claimed that their skin burns very easily and never tans. 24% said that their skin burns easily and rarely tans. And the largest proportion, so 39%, stated that their skin sometimes burns and gradually tans. Then you can see a smaller proportion reported low sun sensitivity. So that's 18% felt that their skin rarely burns and tans easily, while a small minority, so about 7%, claim that their skin rarely or never burns and tans darkly. I suppose it is interesting that although only 5% of respondents self-identified as having skin type 4 or above, 25% reported sun sensitivity consistent with these darker skin types. So that's, I suppose, a thing to consider when we're looking through this research for, I suppose, learning for ourselves, and I suppose how people understand what their skin type is when it's non-exposed. So that's something we'll consider as well when we're looking at the parents, I suppose, when they're looking at their children's skin type as well. So I suppose then we looked at their sun protection behaviours. So in Ireland, we asked for both in Ireland and abroad. So in Ireland, most common sun protection methods used by parents are sunglasses, 73%, followed by sunscreen at 62%, and then third was t-shirts, long sleeves at 62%. Then when parents are abroad, the most common sun protection methods used is sunscreen at 82%, followed by sunglasses at 81%, and then shade or an umbrella at 64%. So we would have, I suppose, when we were doing this piece of research, would have kind of looked more deeply at the findings and maybe what the difference are between male and female. So males were more likely than females to always or most often wear a hat outdoors, while females were more likely than males to wear sunglasses. And half of respondents aged 18 to 34 rarely or never use sunscreen at home, compared to 38% of the 35 to 40-year-olds and 27% of those aged 45 and older. Then I suppose the next screen, when we look at parent sunscreen use, so we asked them what sunscreen, so what SPF they use at home in Ireland and while they're abroad. So we can see there that the highest SPF at home in Ireland is 50 or higher, so 38%, followed by 30, 15% use SPF 15. You can see there that actually 7% never use any sunscreen in Ireland at all. Whereas when people are abroad, as what you would predict, more people are likely to put on more sunscreen and at a higher SPF. So then when we look at parents' reapplication of sunscreen, so how often they reapply sunscreen. So at home in Ireland, you can see there that every 3 to 4 hours is the most common answer, so 35%. This is followed by people think that they only apply it once. It lasts all day. Interestingly, there is no set pattern for 25% at home in Ireland, so I suppose people aren't as likely to reapply or might be more ad hoc in terms of when they apply their sunscreen. And then some people would apply, so only 11% applied every 2 hours and 6% applied every hour. Then when people are abroad, you can see that more people are likely to reapply their sunscreen more often. So 31% are applied every 2 hours, 39% reapplied it every 3 to 4 hours. There's only 9% that have no set pattern for the sunscreen as well. So then we look at parents' incidence of sunburn. So when asked about sunburn occurrence this year, so in 2024, either at home or abroad, the largest proportion of parents reported not getting sunburned at all, so that's 37%. But we know that 32% experienced sunburn once, while 31% reported sunburn multiple times. So then when we look at parents reported sun protection behaviours for their children, so parents were then asked specifically about their children. So you can see there with the skin type, so parents were re-shown the Fitzpatrick skin type classification scale and asked to select an image that best represents their children's natural non-sun exposed skin. So the majority of parents identified their children's natural skin colour as white skin, so you can see there 60%. Followed by 19% selected pale white and 16% chose light brown. So as shown in the graph, darker skin tones were less common overall. And I suppose not surprising, these findings closely align with the skin profile of parents identified earlier. So then you can see just in the brackets, that's just what the parents had identified as themselves earlier, in case you're wondering that. And then what happens to a child's skin when exposed to the sun as reported by parents. So parents were asked to describe how their child reacts to sun exposure without protection. So once again, the majority reported strong to moderate sun sensitivity. So the largest group, 38%, indicated their child's skin sometimes burns but gradually tans. And then a combined 29% of parents reported that their child's skin either burns very easily, never tans, or burns easily and rarely tans. So I suppose in contrast, a high proportion reported that their child's skin rarely burns, tans easily, rarely burns, tans darkly, and never burns and always tans darkly. So I suppose once again, it's notable that while only 5% of parents identified their child's skin as type 4 or above, 33% reported sun sensitivity consistent with darker skin types. So that's kind of similar to what we saw earlier with parents kind of reporting their own skin when it's exposed to the sun. Then we look at children's sun protection behaviours. So parents were asked the most common method that they use on their children. So in Ireland, 86% use sunscreen, 74% use a t-shirt or long sleeves, and then 72% a hat for their children. While abroad, 89% would use sunscreen, 79% would wear a hat, and 75% would use a shade or an umbrella. So I suppose parents are less likely to use a hat or sunglasses or to avoid the sun during the middle of the day as their child gets older. But the frequency of using sunscreen and t-shirts or long sleeves to protect children at home, I suppose, shows little variation in terms of their age. We know that sunscreen is by far the most popular sun protection measure for children abroad, and it's used more frequently on older children, with 74% of parents always applying 8 to 10 to 12-year-olds compared to 56 of the 4 to 6-year-olds. But we know that maybe wearing a hat and keeping them in the shade would be more common for the younger age groups. We also would have asked parents their children's sunscreen use, so what SPF they put on their children. So 2/3, so 68% of parents apply SPF 50 or higher to their children. 29% would use SPF 30 or lower, and 2% never use sunscreen on their children in Ireland. Then the large portion of parents report applying sunscreen of SPF 50 or higher to their child abroad. So you can see 75%. And the portion using SPF 30 or lower was 24%. And 1% that said they never use sunscreen on their child while abroad. So I suppose parents are more likely to use lower SPF on themselves compared to their children, even when abroad. Then we look at the reapplication. So you can see their parents tend to reapply sunscreen to the children more frequently when abroad. So with the majority, so 53% reapplying every hour or 2 hours compared to 34% at home. The minority apply sunscreen once per day, so that's 13 at home and 7% abroad, believing that it lasts all day. And I suppose a similar proportion report having no set pattern for applying sunscreen either at home or abroad. And I suppose these results also highlight that parents tend to reapply sunscreen more frequently to their children than to themselves, both at home and abroad. Then when we look at the incidence of sunburn, so approximately 1/3, one quarter indicated that their child had experienced sunburn once. So they were asked about in that year, so in 2024, how often they'd been sunburned. 19% reported multiple instances of sunburn, which were more common among male children and those aged 4 to 6. And then most parents reported experiencing multiple sunburns themselves. So as we said earlier, 31% compared to their children, so it's 19%. And I suppose this highlights that parents are generally more concerned about protecting their children's skin than their own skin from the sun. So then when we look at attitudes to sun exposure, so we would have asked parents their opinions on a number of different statements. So 70% try to set a good example for their children when it comes to sun protection. 77% of parents disagree that tanning through sun exposure involves no risk. 76 disagree that getting sunburned for a suntan is worth it. 68% express concern about skin cancer from sun exposure or tanning. 53% feel more attractive with a suntan. 46% feel healthier with a suntan. And 42% believe that suntan is necessary for vitamin D production. So I suppose it is interesting that 42% believe that suntan is necessary for vitamin D production. And I suppose when we broke it down by the age cohorts, it was about 50% for parents aged 18 to 34. And I suppose this highlights the need for better communication to inform people of that there are safer alternatives to maintaining healthy levels of vitamin D. And then I suppose parents were also asked about for their children. So they agree, 78% agree that sunburn during childhood is dangerous and could lead to skin cancer. Later in life, 29% are comfortable with their child getting a suntan. 27% believe that their child looks healthier with a suntan. 33% of parents surveyed believe that suntan is necessary for their child to get vitamin D, and 58% disagree that they find it difficult to protect their child's skin from the sun. So then when we look, I suppose, just at the conclusions and recommendations, so I suppose for ourselves within the NCCP is kind of to look at maybe what more education awareness we need to put out there for parents and for their children. So as we said earlier, males are more likely to wear a hat and t-shirt for sun protection, especially when abroad. Females are more likely to use sunglasses, sunscreen. Younger parents tend to exhibit less frequent use of sun protection measures compared to older age groups, and that's across all of the behaviours. For SPF usage, most parents reported using sunscreen SPF 30 or higher, but a significant proportion of parents, particularly younger, still opt for the lower SPF. So that's SPF 15 or lower, both at home and abroad. Then with sunscreen reapplication, so 11% only apply every 2 hours and 35% every 3 to 4 hours. 23% apply sunscreen once, but even it lasts all day. But I suppose it's really important to know, we know that sunscreen should be reapplied every 2 hours or more frequently after swimming, towel drying or sweating. We know that there's no sunscreen that lasts all day, even though that there is some brands that state that, they still need to be reapplied every 2 hours. Then we look at parents' own sun protection behaviours. So parents, I suppose, generally exhibit high levels of awareness about the risk of skin cancer, and 70% try to set a good example for their children, which is really positive to see. And a large proportion of parents still would associate sun tanning with feelings of attractiveness and health. And I suppose one of the concerning findings is that 42% of parents incorrectly believe that suntan is necessary for vitamin D production, and 33% of parents believe that suntan is necessary for their child to produce vitamin D. So I suppose when it comes to vitamin D, the Department of Health recommends vitamin D supplementation for everyone. So the amount you need depends on your age, your skin tone, your situation, and the time of year. People with darker skin or reduced sun exposure would need supplementation all year round. And I suppose it's always important to protect yourself from strong sunlight to prevent skin cancer. So our bodies can still make vitamin D from sunlight even when using sunscreen, wearing a hat, and are protecting our skin from sunburn during the summer months. In winter, we do know that the sunlight isn't strong enough to make vitamin D, so that's why supplementation is recommended. And then I suppose the sources of vitamin D, so small amounts can be found naturally in some foods, such as tinned oily fish and eggs, and then there is some fortified foods such as margarine, low-fat spreads, some breakfast cereals, milk, yogurts, and powdered milk. But I suppose the amount of vitamin D in these products varies, so it is important to check the label. But I suppose the I suppose often the amount of vitamin D added is quite small. So that is why the Department of Health have recommended supplementation for everyone. So here you can see the recommended daily vitamin D supplementation. So if you can see for the 0 to 12 months, 5 micrograms per day, and that is all year round if breastfed exclusively, or if taking less than 300 ml of infant formula per day. For the children 1 to 4, it's 5 milligrams. And again, for most people, it's between Halloween, St. Patrick's Day is when you need to take supplementation. Same for children. For teenagers, it's just the and adults and older adults, it's just the actual dosage changes. Whereas for older adults, so 65 years and older, it's all year round. So I suppose we would recommend to check with your pharmacist or healthcare professional to ensure you're taking the right supplementation, and you can go to your pharmacy to find out more about vitamin D supplementation. Then I suppose just some other final conclusion recommendations. So as parents express a higher level of concern for their child's sun protection than their own, with 82% showing greater concern for their child's skin safety. The incidence of sunburn, so I suppose fewer parents reported multiple sunburns in their children in 2024 compared to themselves. But sunburn, I suppose, remains a concern. So a lot of people are saying that they're using sun protection, they're putting on sunscreen, they're sitting in the shade, they're wearing the hats, but we're still seeing a high number of people getting sunburned. So I suppose the question is it due to the reapplication of sunscreen? And I suppose just some maybe misconceptions around the importance of sun protection. So I suppose research indicates that experiencing severe sunburn during childhood, that 3 or more incidents before the age of 20, is associated with 2 to 4 times higher risk of developing melanoma skin cancer later in life. So to minimize this risk, skin protection during childhood is really, really important. I'm not going to go through the SunSmart 5S because I know that Aoife and Louise will be going through that later on. And I just wanted to highlight just some key things to consider. So I suppose in Ireland, we sometimes think that Irish sun isn't real sun, but skin cancer is the most common cancer here in Ireland. And we should be using sun protection as part of our daily routine between the months of April to September, even when it's cloudy, because UV rays can still get through cloud. When it comes to sunscreen, apply generously more than you need. Check the sunscreen's expiry date and to store in a cool, dry place. And then also, no sunscreen offers 100% protection, which is why we always say it should be the last form of defense and should be used with clothing, a hat, sunglasses, and shade. So just before I wrap up, I just wanted to run through just some resources and information, just for, I know we've parents, teachers, childcare, creches, and healthcare professionals on the webinar. So just kind of some key information if you want to find out more. So our annual SunSmart campaign runs from April to September every year. You can find out more by searching SunSmart, hse.ie/SunSmart, or the hashtag SunSmart for more information on the campaign. We have our Get SunSmart Children's Art Competition, which runs till the 9th of May. That's Friday the 9th of May. It's open to all preschool and all primary school children. There's 4 age categories. The overall winners will have their artwork featured as part of the 2025 SunSmart campaign. Also, with being with a chance to win an OPW Family Heritage Card, a family day pass to Dublin Zoo, and a national book token. So more information is at gov.ie/getsunsmart. We have a wide range of information resources. So we have information for parents on the importance of protecting children's skin. We have resources like Your Questions Answered. So when it comes to all of the sun protection behaviours, what you need to know. And then we have some resources for kids, such as the colouring in of the SunSmart picture, or the importance of having your SunSmart kit at the door, ready to go out, be prepared. And all of our resources, both to download and hard copies, are available on healthpromotion.ie/products. These are free of charge. So when you go to the website, choose cancer from the drop-down menu and you'll find all of our resources there. We also have SunSmart lesson plans and activity sheets available for primary school level. So these are for junior infants up to 6th class. The subject is SPHE. The strand is myself, strand unit, safety protection. And these resources are available to download from hse.ie/skin cancer prevention. You can also email us to order some copies. We are in the process of getting them put up on healthpromotion.ie. They're just not up there yet. They will be up there shortly if anyone wanted to order any hard copies from there also. And then just to announce that we are have a SunSmart School accreditation program, which is just starting off at the moment. So it's open to both primary and secondary schools. So you can apply to be a SunSmart School. There is a SunSmart School toolkit resource, which provides you with information, resources, and supports for schools to become SunSmart. So you can order these from helppromotion.ie. Again, they're not quite up. They're on their way to helppromotion.ie at the moment. So hopefully by next week, they should be up there and available to order hard copies, but there is downloads available currently on that website. And then for any healthcare professionals, we do have e-learning modules. So we have one on skin protection. All of these modules take about 10 to 15 minutes to complete. So you can do one on skin protection or any of the other modifiable risk factor behaviours. You can find out more at hseland.ie. And then I've just included our email address. If you if you have any further questions you would like to ask, you can find information on our public facing website, which is hse.ie/sunsmart. We have information for healthcare professionals on hse.ie/skin cancer prevention. As I mentioned earlier about the resources, and then we also have a newsletter which you can sign up to. So it's Irish Cancer Prevention Network.com. And we will be sending around all this information following today's webinar as well as the recording from the session. So if you're not able to take everything down, don't worry, it will be sent to you after today's session. So that's all from me. And if you have any questions, we'll be doing a Q&A at the very end. So feel free to ask any questions you think relevant. Thank you.
Thanks, Maria. So now it's over to Louise and Aoife to tell us about the importance of sun protection for children and the steps that we can take to look after our children's skin.
Hi, I'm Louise Fleming.
Hi, and I'm Aoife Maloney. And we're both skin cancer nurse specialists here in St. Vincent's University Hospital. Thanks so much for having us here today. So we're going to chat about protecting your kids against the damaging effects of the sun. So I'll let you lead there, Louise.
So we know that skin cancer is the most common form of cancer in Ireland. And it accounts for approximately 11,000 cases annually. And it is the number of people who have been diagnosed with skin cancer is increasing rapidly in Ireland. And for that reason, that's why it's important for us to protect our skin from the sun, and also knowing who's at risk for skin cancer development.
Yeah, so just following on from what Louise said there, it is the most common cancer in Ireland, as she said, and I suppose who is at risk of skin cancer. So this is kind of applicable to everybody, both adults and children. So people who are fair-skinned. So generally, a lot of us in this country are fair-skinned. So you've fair hair or red hair and blue eyes. Just our genetic makeup predisposes us, unfortunately, to the risks of skin cancer. And people who've had significant cumulative exposure to ultraviolet light. So who is that? So it's people who have lived abroad for years, outdoor workers, farmers, postmen, construction workers. All these people are at higher risk. Outdoor hobbies, swimming, golf, walking, hiking. Sunbed use, so that dramatically increases your risk of skin cancer, sun holidays, which the majority of us have been on, and childhood sunburn, which is most applicable in this talk today.
And we know that if your child is badly burnt more than 3 times before they're the age of 20, they're double the risk of developing a skin cancer as they're in adulthood. So that is why it's super important for us to protect our skin from the beginning. We know that a tan, the myth goes that a tan protects your skin from sunburn. It is a good base, but that is not true. This is damage that is caused to your skin, and so it's really important, not to get a tan, and at all costs avoid getting sunburnt. If you have a history of skin cancers in the past, that increases your risk of developing skin cancers. If you're immunosuppressed, so people can be on some medications to suppress their immune system, and that includes children. So it would be important that they are aware of minding their skin and monitoring their skin. And people who are organ transplants, they are increased risk of developing skin cancers also.
So what can we do then to reduce your risk? So be SunSmart. So what does that mean? So this is applicable again to both adults and kids, but we have made it more appropriate to kids given the context. So seek shade, we should all be doing that. We should be avoiding the sun when it's at its highest. So that's between 11 and 3. And just on a note of that, babies 6 months old and under should never be exposed to direct sunlight. So they should be definitely seeking shade rather than the use of sun cream. Slip on your clothing, so cover up the skin as much as possible. So close woven material that doesn't allow the sunlight to penetrate through clothes, or I'm sure we've all seen in the department stores clothes that are labelled UVA or UVB protectants. You've seen it, I'm sure, in a lot of the swimwear with kids. So that type of clothing is very important. Slap on a wide brim hat. I know it can be tricky getting kids and babies to wear hats, but it's so important. And a hat that has a wide brim, so it protects the ears, it protects the back of the neck, and it protects their face. So not just a peaked cap, a wide brimmed hat. So slap on the broad spectrum sunscreen. So this is super important. So the sun cream should be have protection against UVA and UVB rays, and it's at least 50 plus. And the key is reapplication. So you can't put it on in the morning and then not put it on for the rest of the day. It needs to be reapplied. And it should be reapplied as regularly as you feel you need it. If your children are hot and sweating from running around, and if they're in and out of the water, and regardless of that, it should be reapplied anyway. The UVA and the UVB protection is very important. It protects against the different type of harmful rays from the sun. And again, can't re-emphasize the importance of reapplication. And then slide on the sunglasses. So that again can be tricky with kids, but the wraparound ones are great for children and babies. So also you should be looking for sunglasses that offer 100% UV protection, as it reduces the risks of cataracts in later life and in adulthood. So none of these things in isolation. None of these steps should be used in isolation. They should all be used alongside each other. So wear the sun cream even with the protective clothing, because the hands are still exposed, the feet are still exposed, and reapplication and seeking shade is super important.
So sun cream, we talk a lot about it, and it's probably something that people use majority. And there are lots of things that people don't do when they're applying their sun cream. So as Aoife said, even though if you're covered up head to toe with your hat, your hands are still exposed, so it's important to cover any area that is not covered by clothes, that you are applying your SPF to that area, to your sun cream. The importance is that you put it on 20 minutes before you go outdoors. And then thereafter that you put it on every 2 hours, or if you've been swimming, or you've towel dried, or you've been sweating excessively, it's really important to reapply because you're not getting the same protection. So also when you're looking, you don't want to forget your lips, because SPF sun cream doesn't taste exactly nice on the lips. So there are lots of readily available SPFs that you can get in a lip balm form. And what you're looking for is the UVA. UVA marking will have a UVA and it'll have a circle drawing around it. And that is a good indication that is protecting you from UVA. And then the UVB proportion is that you're looking for the SPF that's relating to SPF. And the SPF would need to be, for kids, it needs to be 30, it needs to be 50 and above. Is what we would recommend. So you also maybe get a lot of suggestions, or there's a lot of marketing around sun creams that can be applied once a day, but we don't recommend any sun cream to be applied once a day. They should be applied as above. and putting enough of it on. If you're not putting enough of it on, you're not getting the protection that you are required. So they usually would say a tablespoon per area of your body. That's what you should be applying to kids. So obviously it's really difficult to put on SPF on kids, and some people have suggested maybe making it a bit more interactive for kids, that they could use. I've heard somebody using a large, wide paintbrush that they've used for putting on the, say, fake tan, and they use it for putting on kids because kids like brushing, and it makes it useful for them to be interactive and a bit more enjoyable applying the SPF. So there's also about the UVA and UVB. You know, there are lots of brands that are out there, and if they've been through the European market and sourcing the European market and are on the shelves in Ireland, they have to meet a certain legislation before they can be sold. So ones that are in Lidl, they have a good one in Lidl which provides adequate protection. As long as it has, as I said, it has the UVA symbol on it, and it'll have a circle around it, and then it'll have the UVB, which is relating to your SPF, which as I said would be 50 above. So there's lots of the Boots Sultan ones are also a good brand. Like, you know, we don't stand with any brand, but trying to make it more affordable, because sun cream can be very expensive. So knowing what to look for in sun creams is key for protection.
Yeah, so I'm just going to carry on again to just reiterate what Louise and I have both been saying. The myth around the more expensive the sun cream, the higher protection is indeed a myth. And exactly as Louise said about your UVA and your UVB exposure. But I suppose, when do we use sun cream? We should be, in an ideal world, be doing it as part of our daily routine, because that way, once you just get used to doing it, you'll continue on doing it. So, but especially from April to September, and even when it's cloudy, so often we'll hear, but it's cloudy, there's no sun, there is still UVA and UVB rays present even when there is clouds in the sky. So that's another trap to not fall into for either yourselves or your kids. So the UV index is a good indicator. And it'll actually tell you on your phone. And
I'll just add a little thing there as well. So on the UV on the phones, you can scroll down to the weather apps, and they're listed at the bottom. Will be the UV index, and what we want, you need to be applying it from whenever it says, obviously, as Aoife said, all the time, but especially when it's 3 or above, we should be applying our SPF to when we're out and about. And also, you know, as Aoife said, getting it into your daily routine. You can get moisturizers now that you know, you don't have the Casper look. People were really afraid because not afraid, but disliked using it because you would always have this white look about you. But the engineering behind sun creams and SPF has really improved, and the molecules now are smaller, so they're not as white looking, so it's more user friendly. So you can get moisturizers that have the good SPF and UVA and UVB protection in those also.
Yeah, so to follow on from that, then vitamin D. So especially, it's kind of really super important with kids, the vitamin D. So definitely the summer sun, and just the sun in general, is a source, as we hear so often, from vitamin D. But it's a risk versus benefit thing. So it's so important to keep your child's skin safe from the damage of the sun. And all children under 5 should be on a vitamin D supplement anyway. That's the recommendations. So I mean, as kids get older, it will be impossible for them to seek shade completely when they're out playing. But it goes back to the points that we've already reiterated, that they're wearing their sun cream, it's being reapplied, they're in protective clothing, and they should be on a supplement anyway under 5. So it's not reason enough to just let them run, be exposed to the sun without any protection. For vitamin D absorption, it's not best practice. So just a note on that, because obviously it's super important with growing kids for their developmental health.
So when should we be going to our GP to identify something needs to be reviewed? And this is not just for kids, this is for yourselves as well. Using the opportunity to touch base, if something is not healing and it's a persistent spot or sore, that's something that I would encourage anybody to go get checked. Also then if something is, it hurts or it's itchy and crusts over, the crust falls off, the crust comes back again, that sort of crust cycle is something that should be reviewed. And if it bleeds, it should be, don't just sit on it, always get referred in. And also, a new mole that looks different. So in our lifetime, you'll develop moles right up from early ages right up into your 30s, and in that time you can develop moles and they'll generally match each other. But what you're looking for is that if a new mole has developed and it looks different to anything else on your skin, and that is something that you would be no harm in going to your GP and asking them to assess you, and they can make the decision whether or not then to refer you on for a specialist review in the hospital.
Yeah, so useful resources, which we'll kind of just reiterate and go over what we chatted about here today, is the Irish Skin Foundation, Irish Cancer Society. There's some links there as well, and the HSE gives very good practical advice, again, that we've chatted through today on being SunSmart. So we hope that you found something useful from the chat today. Thanks very much for having us, and we welcome any questions.
Thank you.
Thanks very much, Louise and Aoife. So now it's time for a panel discussion. Unfortunately, Louise was unable to stay for the question and answer session, but Maria and Aoife will be happy to take your questions. So we have lots of questions coming in. So the first one here is for Aoife. So it says, should I aim to use more natural products for my child? I'm hearing a lot of noise about toxins in regular sunscreens.
Yeah, it's an interesting question, I suppose. And my understanding is from the research, there's not a lot of robust evidence to say that the chemicals in sun creams cause a problem, but there is a lot of evidence to back up that the use of sun cream protects against skin cancers. On that basis, I would definitely be looking at what the evidence does tell us as opposed to what it doesn't concur. But with the evidence is robust against, if you use your SPF, it will reduce your risk of developing skin cancer and the damaging effects from sunburn rather. So I'm not too sure if that answers the question fully, but that would be, yeah.
Thanks, Aoife. And I suppose then in keeping with that, we know that some of the natural products that people are talking about don't provide adequate protection.
This is
the
it.
reason. That'd be correct. Yeah. Okay.
Yeah.
Thanks, Aoife.
Yeah.
So Maria, one for you here now. Is a baseball cap okay to use on my child rather than a wide brimmed hat?
Yeah, so I suppose we would always recommend to use a wide brimmed hat. So we know that baseball style caps, they don't protect the back of the neck, the ears, and the face. And they're places where people are very likely to get sunburned. So if you do wear a wide brimmed hat, you're getting that extra protection. You don't need to worry about the sunscreen to apply it, to reapply it right throughout the day. And obviously people might be sweating in those areas as well. So the sunscreen might rub off. And we know for parents with small kids, so a soft hat are available. So there's different types. So there's the bucket style hats. There's also the Legionnaire style hats. So they kind of cover the back of the neck quite down a good bit as well. But the soft hats are available for babies that allow, I suppose, freedom of movement and easily crease or crumple if they're resting their heads. So yeah, we would definitely recommend a wide brimmed hat if possible. At least then you're just not worrying about the reapplication of sunscreen.
Thanks.
Sorry, Bridie, can I just go back to the question there about the chemicals in the sun cream? Sorry, I forgot to add, just to reassure people if they did have concerns, that I think we might have touched on it previously, that any sun cream in the market in the European Union has gone through very comprehensive manufacturing process and legal process again in order to be on the shelves. So just to, for people to look out on that with their sun cream, that it does go through a comprehensive process before it's approved for use on the shelves in the EU. So, you know, maybe that might reassure people, you know, because it's understandable. You want to mind your kids and what they're putting on their skin. But there's a whole process that goes on in the background that maybe people don't know about safety and the use of it. Sorry, just to interrupt there.
That's great, thanks, Aoife. So yeah, I'm sure people would be reassured by that. I
Yeah.
have another question for you here, Aoife.
Yeah.
Does sunscreen expire?
Yeah, very good question. So it does. Again, like you know, like anything, there should be an expiration date on the back of the sun cream. Now sometimes there isn't. And I suppose the rule of thumb, some research you will read that it's good for use of a maximum of 3 years, but I think really anything after 12 months, the efficacy of the active ingredients reduces. So if you do, you know, if you have sun cream that's in the press since last year, you know, it probably mightn't work as well as so I would definitely go out and get a newer bottle, but it should state on the back, like everything, an expiration date when it's past that. Yeah.
Okay, thanks, Aoife. I have another question for you here, Maria, which is kind of related, I suppose. What should I look for on a sunscreen bottle when buying?
Yeah, so I suppose what we would recommend is for adults to look for SPF 30 plus on the bottle, and then for children it will be an SPF 50 plus, and then for it to have a high UVA protection, so to be broad spectrum, so it covers both the UVA and the UVB rays. So yeah, with SPF it's 30 plus, 50 plus for children. And then when it comes to the UVA, it should have the UVA wording with a circle around it that shows that it complies with EU regulations, as Aoife had just mentioned. So it's tested rigorously to make sure that it's compliant for EU standards. Now I know that Boots have a star rating as well, so you might see a UVA logo with stars on it. So if it does have the stars, you'd be looking for 4 or 5 stars. That would be the most amount of stars. So the max you can have amount of stars on a bottle will be 5. So we'd be saying 4 or 5. And I know that there is some international brands, so like Korean type brands that are on the market in Ireland as well, that people can buy cosmetic products which have SPF, and they can say PA on it. So if it has PA, it should have at least 4 stars. So it should be PA plus 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 on it. So they're kind of things to look for on the sunscreen. And then obviously just to remind people that it should be applied 20 minutes before going outside, should be reapplied every 2 hours. And then if someone is sweating or towel drying, it should be reapplied more regularly. And I suppose it's important to note as well that the higher price doesn't always mean a better product or better protection. It's just to make sure that it has the SPF, it has the UVA, it's broad spectrum. And I know some sunscreens say that you can apply once or that they're water resistant, but regardless, you should be still reapplying every 2 hours.
Great, thanks, Maria. Another question here for you, Aoife. So what does UV radiation mean, and what is the difference between UVA and UVB?
Yeah, so again, another good question. So the UVB rays are those rays that cause burn. They cause your skin to burn. So essentially that increases your risk of skin cancer. And the UVA rays, they penetrate deep down in the deeper layers of the skin. So often you hear about aging skin, or skin that doesn't look correspond with someone's chronological age. So that causes the aging of your skin, the UVA rays, and the UVB rays burn. So A for aging and B for burning is a good way for people to remember. So the UVA rays aging and the UVB rays cold burning, but they're both just as harmful in each other. So just to back up what Maria is saying there, when you're looking for your SPF, it needs to be UVA and UVB coverage in your sun cream. Yeah.
Thanks, Aoife. So lots of questions, but we're running out of time now. So just a final question for Maria. Where can people find out more about the SunSmart lesson plans and accreditation process?
Yeah, so people can either email us at prevention@cancercontrol.ie if they're looking for any resources. They are up on, or in the process of being put up on healthpromotion.ie. So there is the digital copies available there, but in the next week we hope to have all of the hard copies available But we will be sending around links after today's webinar for everything discussed, for links to different resources, information, and where people can find out more. And we did do a webinar last year specifically on sunscreen with the Health Products Regulatory Authority. So they would, I suppose, look at the EU regulations and make sure products are compliant. So we'll include a link to that webinar as well. It was all about sunscreen, everything about sunscreen in that webinar if people want to find out more about sunscreen specifically.
Thanks, Maria. So I think that's all we have time for. So thanks everyone for joining us today, and to our panelists, Maria, Louise and Aoife. And just a reminder that if you would like more information on how to be SunSmart and protect your and your children's skin, you can visit www.hse.ie/SunSmart, or you can check out the hashtag SunSmart on social media.